No idea.
I can see the webinar page.
Vital information. Something like the vital information. Probably clicking the sound.
No. Okay, well, I think we can start. People can join whenever they're ready. Okay, so can you hear me okay? Is the mic working? Yeah, okay. I don't know, it doesn't seem that it's very loud, but anyway, I'll do my best to project my voice. So welcome everyone to this early Monday morning session, first day of the conference. So really appreciate you joining us. This session is about, so my name is Sophie Boisson, I work for WHO, and this session is jointly organized with the Neglected Tropical Diseases and NGO Network WASH Working Group. That's a long title, but essentially a group that includes many partners who will be with us today. So Sightsavers, NALA, Unlimited Health, and the End Fund. So this session is about sharing and using WASH and health data to improve equity. It aims to explore how these data can be used to better target WASH investments, but also how these can be used to support collaboration across sectors. It really builds on some of the work that we've been doing in collaboration with the NNN and WHO on WASH and NTDs, and I know there's also a lot of interest by other disease-specific programs, for example, cholera. And I also know that there's been in the past other initiatives that have looked at these aspects. In this session, we'll give an overview of existing approaches to bring WASH and NTD data together, but at sub-national level. We'll share some examples on how this joint data have been used in Ethiopia and Nigeria. And then there will be opportunity to engage with you all to seek input on the tool and approaches and how improvements could be made, but also reflect on how to ensure that these data are actually used to guide actions, right? But before we dive into the methods and approach in more details, I wanted to give a little bit of background. So WHO has supported collaboration between WASH and NTD sectors for many years, starting back in 2015 with the publication of a global strategies on WASH and NTDs. And one of the four pillars of that strategy was really focused around the use of WASH and NTD data to highlight inequalities, target investment, and track progress. So in order to support implementation of the strategy on the ground, when we developed a toolkit first published in 2019 that gave a lot of practical tools on the practical steps for collaborating. This toolkit has been updated. The second edition has been published this year, alongside with a training course on the Open WHO platform. But I just wanted to draw your attention to the fact that there's a very specific focus on data in this tool, with a lot of tools that can be used to support the use of WASH and health data jointly for decision making at country level. I just wanted to just have these slides. Okay, so how can data sharing improve health and equity? You can see this simple 2x2 matrix. Of course, in red, you can see this is the target area that should be prioritized because there's a low level of access to WASH, but also a high disease endemicity. And the green box is the desired scenario. So this is where we're gonna try to get to through the investment and actions that are taken at country level. I just wanted to say that so there's lots of lots of the global reporting mechanisms on health and WASH reports data and have data available at national level. So, for example, WHO is custodian agency for reporting on SDG target 392 on the burden of disease attributed to WASH. And also we have jointly with UNICEF, the JMP, which report national estimates, but also have some national data, like urban, rural, have the inequalities files, which includes disaggregation by wealth quintiles, but also some national level. But these are often at admin level 1 data. So the question is, how can we find data that are available at the units, the implementation units that is useful for planning, and when doing this work, we realize that there's different case scenarios. So the data may not be available at all. They may be available at district level, but not necessarily at national level. They may be already aggregated at national level, but be located in separate databases, the health and the WASH databases, and there's various scenarios in between. But so when we were working on developing those tools, we were trying to think, okay, well, is there a kind of specific way of mapping, those different scenarios and kind of provide some guidance on what to do about it to bring together these different data sets. So there's lots of issues around data use, data availability, the methodological aspects of that. But obviously, data sharing is also about how it's being used to create and sustain collaboration, how it's being used to drive action. So I think it's important to keep in mind the process. So the process for engaging stakeholders, the process for ensuring ownership and partnerships. And I think that's very critical because we also realize that even when we have data very well available, there's many competing factors that are taken into consideration when implementing and prioritizing WASH interventions. So I just wanted to give a quick overview, and I wanted next to give an example or to ask my colleague Pierre-Yves Auger from the Global Cholera Task Force to just give a very quick example from the cholera perspective, cholera program perspective, because most of this session will be about NTDs, but we thought it would be interesting also to hear from them about these issues about data, bringing cholera and WASH data together and how they're being used. So maybe Pierre-Yves is online, so I will give the floor to him. If you can hear him, Pierre-Yves, can you just open your mic?
I can hear you very well. Can you hear me well?
We can hear you well. Yeah, thanks. Okay, so over to you for a few slides.
Thank you very much, and good morning, colleagues. Very happy to be with you today. In 2 minutes, I'll just highlight 2 key aspects from a cholera perspective on the use of WASH data. And to start with this first slide on the use of WASH data for cholera analysis and advocacy purposes. This slide is about the analysis of almost 5 million of cases of cholera reported over the period 2010-2021, end of 21. And the idea here is to plot the cholera data versus access to water and sanitation. So the x-axis is access to sanitation, either basic or safely managed, and the y-axis is access to safely or basic water, and the bubble is the size of the cholera incidence per million over the period. So in very short, what it shows, and I think it's a clear message, is almost 97% of all cases, 96.7% of all cholera cases over the period came from 31 countries. Those 31 countries are part of the 34 countries with the least access to safe or basic water and sanitation. Basically, below 70% access to water and below 55% access to sanitation. So this idea here is to show how data, and here it is only at national level, I'll come back to that, how data can help us to analyze the countries most affected by cholera. And I must add that among the countries not affected, 2 of them are islands, so that makes things different. But that allows the strong relationship between access to wash and a number of reported cholera cases over the period. So first point about use of data for advocacy and analysis. We like to do the same work at level 1, so at regional, provincial level. We're not there yet, but we hope to be able to do so. This slide is about the second use of WASH data for cholera, and it's about programming at subnational level. And Sophie already mentioned it, but we have a similar complexities on accessing the data to allow us to program. Why do we need them? We need to help prioritize OCV, oral cholera vaccination campaigns, and WASH interventions during preventive campaigns. And we do use WASH OCV joint household surveys to do so. We also use and we also need the data as part of the national cholera plans. We need them to define what we call the priority area for multisectoral interventions, which is looking at the hotspot in terms of epidemiology, but also vulnerability. And that's where we have criteria for WASH access. And you've got here a link to look at the very recent publication from the group. And finally, we need the data at subnational level to help us to cost the WASH services, the WASH interventions required at subnational level. I'll stop here very short just to say we share a lot with you, and we are very much interested to continue working with you on advocacy, on implementing programs. We need better WASH data at subnational level. Over to you, Sophie. Thank you very much.
Thank you very much, Pierre. And we'll come back to that, during the discussion. So there will be opportunities to maybe ask questions and dive in a bit more details. But what I'll do next is move to our next speaker. So that will be Jordi Woods from Sightsavers. And he will take us through the mechanics and the more detailed around the tools and approaches that have been used to bring those data together in order to make them usable. So Jordi, over to you. You have the key.
Thanks, Sophie. Morning, everybody, and thanks for showing up at the first session on a Monday morning. So congratulations. I'm surprised we have so many people in the room, so it's exciting, and those online too. Yeah, as Sophie mentioned, I'm going to kind of dig into the different kind of modalities in terms of this process that we've been going through over the last 5 years or so, in terms of mapping out, how do we kind of match health data and specifically neglected-tropical diseases data together for better targeting. And as Sophie mentioned, it's been really difficult because NTDs has these great robust data sets, but at the district level, and then we've got these great sort of national or subnational sets from the JMP and the various other sources, and making that fit together has been a challenge. So I'm going to kind of talk about a couple of the tools that are now available that we've developed to do that very thing. So first, I'll mention the toolkit that Sophie mentioned. This is the second edition, and this is the one that includes now much more of these sort of deep dive tools for using data or developing such databases. And then the second is the ESPN portal, which is the WHO expanded platform, special, not this, of course, I'm gonna mess this up, but the expanded special platform program. Thank you very much. I do work in entities, I promise. And within that, the subset is this CHIP, which is the Country Health Information Platform. So, first off, there are sort of basically three approaches that we've sort of outlined in terms of data making. So the first, and I would argue probably the most, the best, the platinum option, if you will, is this idea of the data merge, right? So using existing WASH or NTD platforms, and then adding, either WASH into the NTD database or vice versa, entities into the WASH platform. And I've got two other colleagues. We're going to give two examples of each of those cases at the country level a little bit later on. So I'm not going to go much into that. The second is this idea of the decision matrix. So it's essentially a very, very basic Excel tool, and it's sort of for one-off data collection. So you've got, you want to target a specific area or a sub-region of a country, or maybe a whole country, and you want the most accurate data, and you're actually going to go out either collect the data, or you've got a very specific database you're going to want to use. And so we've kind of collated this Excel sheet that is accessible through the WHO toolkit. And then the third is the ESPN entity portal or the CHIP platform, right? And that is where, on an annual basis, the tropical diseases programs have to send in their data on NTDs to the WHO. And that's the ESPN platform. That's where that data is held. And now for the WASH sector, this is, we've integrated the IHME model data set. So this is, I have to put a large caveat on this resource that the data in this for the WASH side is modeled data. But I think that I'll get into a little bit more of the use of that in a second. In that toolkit, this is sort of the flow you would go through. If you are interested in using NTD data and WASH data to kind of make better decisions, better targeting, advocacy, you start, and the first question you ask yourself is, do you have access to WASH and NTD data? If the answer is no, then probably your best option is to use this existing platform, the ESPN portal or the CHIP platform. If the answer is yes, then you want to ask yourself, is there a national NTD WASH database where all of the data could be merged? Okay, so do we have access to a database, and do we have technical capacity to bring in a separate data source, people that can do it, people that can update it, that kind of thing? And if the answer is no to that, then you might want to kind of use this Excel sheet where you're going to do a one-off exercise and really just target, okay, what are the prevalence levels of these specific diseases, and what is the access to basic water sanitation services? And then, but if the answer was yes to the former question, then you would go down this route of really kind of working with either the WASH database or the NTD database. And there's a lot of steps. And I think that this is the part that maybe we naively thought about, great, we'll just merge the data. But there's lots of conversations. There's the thresholds, there's the quality of data when the data was collected. And so these are conversations that have taken years to kind of sort out and agree finally on and then who owns the data, right? So there's a lot of processes that have to happen, but I think from the experience of a lot of countries, that's a really great conversation, because out of that conversation has yielded a lot of really fantastic results. So, without kind of getting deep into the woods, this is sort of a snapshot from that tool in the WHO toolkit. And you'll see in that first table on the bottom left here, you've got the entities table, which is pre-filled with the WHO definitions and the thresholds. And these would likely never be altered, because these thresholds for these diseases have been preset. They've been determined by the WHO and sort of global current science on that. And so that sort of remains. What's on the right, however, are our WASH indicators. So we've got a school section, a household section, and also an additional category of ODI status. And as probably many of you know, that these categories are often, they vary from not only from country to country, but also within country. So that's part of the, you have to make sure that your thresholds are set, and depending on what you're looking for, are you wanting to set sort of a national median or mean, or are you looking for specifically, the global targets? So that's essentially a really great Excel sheet that you fill out. It's got instructions from start to finish of how you would fill that out and put the questions, etc. And this is just an example from Uganda in how that had been used. And so they collected that data, and they were able to really clearly map out, okay, these areas in red, going back to that 2x2 that Sophie shared with us. These are the areas that we really, really want to focus in on. These are the areas that have the highest burden of disease, as well as the lowest access to water sanitation. So if we're going to, with our limited resources, we're going to target any specific areas, we're likely going to target those areas. Now, there are other conversations we can have about where would we want to increase advocacy, for example, or we're really close and we want to really push them over the edge into green. Notice there's not a lot of green. And then in this visualization, other things you can do in that Excel file that they've got here, you can maybe from far away see there are some of these districts are hashed, and those represent districts that have greater than 50% coverage of water sanitation services or basic services. So you can really represent a lot by a simple sort of visualization more than this kind of very colorful Excel table. And then finally, CHIP. So the Country Health Information Platform is a part of it's a visualizing tool used where they use the Microsoft Business AI to generate essentially sort of visualization of neglected tropical diseases data. And I'd mentioned before that on an annual basis, countries have to send in their data on the prevalence data and the Mass Drug Administration data for these diseases, for 5 of the 20 entities. And so what they've got there is they've got the endemicity, they've got the Mass Drug Administration treatments for those diseases that use that. They've got surveys and forecasts, so you know when a country is going to do another survey or forecast. This is particularly, this hasn't happened yet, but this is particularly relevant to trachoma, because in the trachoma surveys, there's actually quite a bit of robust WASH indicators that are collected. So this is specifically an area where you can sort of say, we know that this country is going to be doing this survey in these 25 districts, for example, and we know that they're going to be collecting, level, like ground level, district level WASH information. And then the other part of that's in dish in CHIP is this WASH model data. And again, this, that comes with the big aspects of this is data from the 2017 IHME model data, where they've taken all of the sort of global data sources and modeled that with, I believe it was a 5-meter radius. There's a whole paper you can go and research exactly the methodology, but that's where that data comes from. So that's sort of what the CHIP platform looks like. And then just to kind of give you an outline, what's really great about CHIP is that it really gives you this really very clear dashboard. So you've got up top, you can filter between a specific region of a country. Then you can cycle through different types of years. And then here you've got each, as you hover over a specific district, you can get a pop-up for whatever you're looking at. And so down at the bottom here, you'll see that currently we were looking at an example from lymphatic filariasis. And so this is all of the data that is presently displayed in CHIP. And then you've got this tab over here, our WASH tab. And the WASH tab is particularly great because you can toggle between access to improved sanitation or access to improved water. And then in this instance, we've got an example of schistosomiasis. And then you can click. So you'll see it's populated all those areas, but then you can sort of really click in and visualize down on those 7 districts that are high levels of schisto and very, very low levels to improve water in this case. So it's a great tool in terms of being able to really focus down on and use this. I think, again, back to a lot of questions are, well, but this is 2017 model data. I think that the important thing here is that this really is more of a conversation starter. And I think it's a really powerful tool to be able to, to show up at someone's desk and say, look, these 5 areas need attention. And they may say, well, that data is wrong, but at least it's a start of the conversation. So I think that that's one real, I think, benefit to the chip platform. And I think that, one of the conversations we'd like to have with this group of people is how can we access more current data for these tools so that we can really, when we go and have these conversations or joint collaboration meetings, that we're talking apples to apples and really know where we're trying to target those research. This is version 2.0. This is a static screenshot, but this is will be the redesigned version of the chip platform. So it's very, very similar. The only thing that I think is worth highlighting is that it does put down here these different decisions or actions you might want to have. So you've got the priority areas, you've got the areas in purple that are areas for joint planning, where those are opportunities where we could really do more planning together. The orange is more the continued work where we're doing okay, but we could do better. And then the green is like, hey, we're doing okay here. So that is a lot of sort of technical things on dashboards. And I think we'll have a chance to kind of dig in more and discuss how those of us in the room and online can use these current tools and how we can make them better. But I want to kind of dig into going back to the data merge, where I think sort of the gold standard of this, and turn to my colleague, Naomi from NALA, who's going to give us an example of the Ethiopia experience. And I'll let her do the talking. So thank you.
Thank you, Jordan. Sorry, I lost my voice a bit, so I hope everyone can hear me. I'm Naomi Kaplan, I'm from NALA, and we work very closely with the Ethiopian Ministry of Health and the regional bureaus in setting up these WASH and NTD coordination platforms across the country. So I'm going to give a bit about a background of the context in Ethiopia and then go into how that is used specifically. So in Ethiopia, there's a very, very high burden of WASH-related NTDs, specifically schistosomiasis, intestinal worms, and blinding trachoma. In fact, Ethiopia has the highest burden of trachoma in all the world, and it's about half of the world's global burden. There's also LF and Onco in Ethiopia. So they've been prioritized by Ethiopia for the last decade as diseases, as a public health crisis, as something that the government wants to address. And the primary intervention has been preventive chemotherapy. So fortunately, these diseases are very easy to treat with drugs and fairly cheap, especially with the drug donation programs. However, reinfection has remained high and endemicity has remained high throughout Ethiopia, despite these mass drug administration campaigns. But one of the reasons is that the underlying cause is not being addressed. So as these diseases are either caused or worsened by water, sanitation, and hygiene conditions, if those issues are not being addressed, then reinfection happens. So for this reason, the Ethiopian government recognized the connection of WASH to the elimination and control of NTDs in 2016 and reaffirmed it in 2021, and decided to try to bring together the work of the two different sectors, since before that time, the NTD sector was mostly involved with the drug distribution and the surveillance, not as much with WASH. So there are some initial challenges for this, these coordination platforms. One is that WASH interventions were usually coordinated completely outside of the health sector. Some were done by the Ministry of Water, some were done by the One WASH National Program. So the health sector did not have much interaction with these infrastructure programs. Also, in general, the WASH sector, because they had different donors, different priorities, they're focused a lot more on equity and reaching the largest number of high need people as possible, like getting to the areas with very high populations, and they didn't necessarily look at health data. So that was also where there was a disconnect, where they're trying to reach many people and they weren't looking specifically at where there's high disease burden. And also the sectors in Ethiopia, due to having different donors, different ways that they're set up, there are very limited platforms to bring everyone together to share this information and to find joint solutions. That was the initial challenges. There were many, but those were the big ones. So part of the solution that was brought up is that the Ethiopian Ministry of Health, they prioritize multi-sectoral coordination specifically as a strategic goal, and a second and third NTD master plan as a way to encourage joint planning and data utilization. And they endorsed two guidelines. One is the National WASH NTD Coordination Framework, which guides the national efforts to encourage multi-sectoral coordination, and also a district level toolkit, which is a picture of, which is based very closely on the WHO toolkit, except adapted to the Ethiopian context and also to the district level. So looking more at the implementation level. And to date, so far, we've launched these platforms in 515 districts, which is about 70% of the endemic districts. And we're hoping to reach all endemic districts by 2030. So some NALA supporting, some are done through other NGOs, and some are done completely through the government. And the goal is to help them start, and then the government takes over. And one of the tools that is used, as Jordy mentioned, is this data merge system. So the NTD sector in Ethiopia uses a system called DHS2 for its health management. It aggregates all of the NTD data across multiple reporting periods into a single database. So it had a lot with prevalence data, a lot with drug distribution data, not WASH data. So it wasn't ever considered a part of the national level, regional level strategic planning. So as a part of that, I believe Jordy and Sightsavers are very involved in this. They had an intensive consultative process. They selected specific WASH indicators, and then they used the ones from UNICEF initially and integrated those into DHS2 because of about 4 to 6 different indicators. And it's been a great tool for advocacy because then you can create these layered maps. You can use graphs and charts to show trends over time. And it really helps strengthen the advocacy and coordination efforts. So you can see this layered map shows both the trachoma prevalence by the blue circle, and also the amount of households that have low sanitation coverage. So you can see the connection. You can use that to prioritize where to do work. So that has been a really great tool, but there's of course a capacity gap, and also making sure there's so much data on the system, making sure people even know it's there to use. So one of the tools that we launched 2 online courses. One is more specifically going through the toolkit, a step-by-step guide to how to set up these platforms. And the second one is more specifically on how to use the data merge in DHS2. And so far we've gotten people from different regions of Ethiopia, which I think there are about 11 regions of Ethiopia. So we've covered most of it. And it's predominantly people from the health sector, but we're also about a third of them are coming from the WASH and education sector as well, which is really important that they know that this system exists also. And just for anyone who's interested, this online course is open to anyone. Only people working in Ethiopia get a certificate, but if anyone's just interested to see what's in there, it is open to anyone at washington.org. And there have been quite a lot of challenges that are still ongoing, but we're trying to adjust them over time. So one of them is that in Ethiopia, different sectors track different WASH indicators. So the Ministry of Water looks at the water coverage, Ministry of Health looks at hygiene and sanitation coverage, hand washing stations, open defecation rates, and the Ministry of Education tracks a lot of data related to school-based WASH. So trying to bring all that data together in a very unified way has been a bit challenging, especially since they have different reporting schedules and they're tracking things in different ways, depending on the sector. So that has been a challenge. Also, to access DHS2, you need to send a formal request letter. So if you're not one of the people specifically designated to use the system, say you're an NGO who wants to review this data, you do need to go through some bureaucracy. Also, there is a bit of a capacity gap in analyzing and using the database. So that's why we launched the online course. We're hoping to address with remote support and also in-person support. And another issue, DHS2 is only used by the health sector. So in the WASH sector, if they want to plan interventions, they don't necessarily have access to it unless they request, but it's still a great way to have a starting point for discussion. So when they have these, that's why we built these platforms where they come together for quarterly meetings or annual review meetings where they can all look at the data together and then make planning. But I still see it, if we could also have a way to integrate more heavily with the WASH sector on that one so that they can use it more on a regular basis. I think that would be a big strength. And in general, it is used mostly on the strategic level, not on the district level. So on the district level, they use more other tools to collect data. And some of these indicators that they're collecting on the district level have not been integrated into the national system. So in these review meetings, we do still have the Excel sheets and the DHS too. So we have to figure out how to integrate all the things that we're tracking into the system and making sure everyone knows what data is useful for this type of planning activities. And another just logistical issue, there's generally a high turnover of the training task force, the technical working group members. So the way it's set up in the district, zonal, regional level is bringing about 7 different sectors together into technical working groups and task force. So not just health and water, but also education, administration, women and child services or affairs, and agricultural sector in the pastoralist areas. So trying to bring all the different sectors that touch on areas that have high NTD burdens. And the problem is that we train them and often a lot of them have left. So then we have to go through a retraining process or hope that they're retrained internally. And then also in Ethiopia, in the last few years, there have been a lot of changes to the regions, to the zones, to the districts. So that also changes how data is collected, how the monitoring systems are done, who is in charge of what. So that has also been a bit of a challenge. But we have had some really great results since we've started this process. So the first trainings were, I believe we did the toolkit in 2017, and the first trainings were in 2018, and we've slowly rolled out to more and more areas. So far, we've seen integrated strategic planning. So in Oromia specifically, it's a region in Ethiopia, the most popular region. They use this shared data in their 5-year NTD strategic plan, and also on the annual planning in other regions. They don't have an NTD plan in those, but just a regular annual planning for the health sector. They use the WASH information, the WASH data for that. It's also helped streamline things. Also in Oromia, they had the 2 separate sectors, the NTD and the WASH, and they created a new structure under one director, which enabled better coordination and data sharing for everything to be more streamlined. Selection criteria for choosing WASH infrastructure projects has been improved. So One WASH National Program is one of the main programs for building WASH infrastructure in Ethiopia. They decided at the ground level, we've really been working very closely with them, and based on the success at the strategic level, they're going to add NTD endemicity, NTD prevalence as one of their selection criteria when they revise the program. It's not just looking at areas that have low coverage and high population, but also looking at the health as well. And they're in about half of the districts in Ethiopia, so this is very great. They'll be doing this. And also in general with the NGO partners, having more evidence-based to where they're allocating their resources. So instead of just picking an area and building WASH infrastructure there, are the NGO partners in Amhara and in Oromia and the South region are now investing in WASH facility construction based on NTD prevalence. So they're using this shared data in their decision-making process. So that's Carter Center, CARE, RDA, Orbis, SMD. A few of these are WASH. A few of these are health NGOs. So that's been a huge positive from this whole thing. And also bringing the 2 sectors together for an integrated monitoring and evaluation. So sharing indicators, sharing discussions on this, doing joint supervision, having integrated M&E frameworks is really supported this work and is leading to a lot of progress in this sector. And a few best practices. One is just making the data usable. So being able to make it in these layered maps, being able to make it into charts and very visual has been a great advocacy tool. So especially if you only have a certain amount of time with decision makers, being able to show these really strong visual images has been very powerful. Also making the data real. I think we sometimes get lost in the numbers and the spreadsheets. So one of the tools that we use is supported supervision. So that's people from the regional and zonal level, and once a year from the national level, going to the ground and seeing what it means, seeing what the infrastructure is like, seeing what the burden is like, and what the work is actually, what work is actually happening. So it's both a great tool for the people, the decision makers, and the ones making the strategic plans, and also it's a good motivational tool for people on the ground, knowing that there is this follow-up and there is this importance and prioritization put on the work that they're doing. Continuous advocacy is very important since it is different sectors. You have different people to answering to. It's easy for things to get lost, but advocating continuously for people to meet, for people to share information, come together is very important. Following up closely on the ground level to make sure whatever progress is achieved is sustained and grown. Also, just the need to capacitate people. So giving both the in-person trainings and also the remote support, whether it's online classes or even Telegram groups, We have some that we send messages to, and we make sure, if they have questions, they can share best practices or challenges they have, and then as a group, they can respond how to react. Documenting best practices, I think in this type of work, Ethiopia was one of the first countries to really launch these platforms in this way. So being able to document this and share it with others, especially when you're advocating to different sectors, like this works, like this is what we've seen, it's very powerful. And as much as we can integrate the routine monitoring, the Washington NTD data together so that they're tracking it together, really helps with the sharing. Another thing that helps, especially initially launching, is that since these sectors often work separately, having recruiting specific people in the government, we had secondees, that's their goal. Their goal is to bring these people together, to bring different data together. That helps, especially in the initial stages. And just to make sure that it's sustainable and that the government has ownership, is that in the end, the government should be the ones. They should be the ones leading on advocacy, monitoring, and supervision. So even if an NGO is providing technical support, it should still be the government that's taking the lead, because we wanted to stay with them after. We want these systems to be ongoing. So that's the Ethiopia context, and I believe we have the Nigeria experience coming up. Do you have
Thank you. Yeah, and just after Nigeria, we're gonna stop and let folks ask any questions or dig deeper into that. So we'll go into Nigeria, we'll go into the opposite version, which is now entities into a persistent WASH database. So Otene, can you hear us? Can we hear you?
Yes, I can.
Okay, well, over to our colleague Otene Oguche from Nigeria. Okay.
Okay, good afternoon, everyone. From Nigeria, I'm just here to share the Nigeria experience, and I'll just talk through some of the steps that's led up to us having a developed NTD WASH dashboard. This process, started over a period of time, which involved many different steps, especially with a landscape analysis which was conducted, and it was aimed at compiling and analyzing national and district level information on WASH and NTD prevalence, as well as programs, behavior change interventions, and their relationships to one another in the context of Nigeria. This landscape analysis findings highlighted some of the gaps and challenges existing in terms of NTD and WASH collaboration or coordination, as you may, in the country. This was followed by an interministerial group being formed, comprising partners and especially the Federal Ministry of Health and the Federal Ministry of Water Resources and Sanitation. These two ministries are very key in terms of NTD and WASH in Nigeria. Of course, the Federal Ministry of Water Resources is responsible for all WASH activities and interventions in the country. And then you have the Federal Ministry of Health, who supervise or make sure that all NTD programs are done properly in the country. And as well as UNICEF and the national body, the Bureau of Statistics, and then with support from Sightsavers, had this group formed that looked at the different indicators for WASH and for NTDs with a view to, bringing these indicators together in a very presentable way that could, go onto a good visual dashboard. Now, the idea behind having these indicators together was to provide the best, form of presenting the data for NTD and for WASH, in a single form where everyone could access it. Now, in the process leading up to this, several meetings were held involving the different ministries, and of course with support from Sightsavers. Following the development of combined indicators, a national stakeholders meeting was held, during which the data merge dashboard was introduced, and of course other subnational level engagements were conducted over the year to look at the dashboard and see how to make it better. And the ministry responsible for hosting this dashboard and uploading data on the dashboard were also had their personnel trained on data access, upload, and update format for updating data on the dashboard, as the case may be. And the dashboard was formally launched on an agreed platform in June this year. I'll just mention that the platform that was selected to host the NTD Wash dashboard is the WashAIMS platform. WashAIMS is the Water Sanitation and Hygiene Information Management System. It's a platform where you have access to wash data in the country, all the relative different wash coordination or wash survey reports are hosted there. So this NTD Wash dashboard is also one of the dashboard that has been hosted on the platform. Next, I will just talk through some of the steps that led to the data merge process. If you see from my earlier comments, in the process leading to the data merge process, the NTD data from different elements of the different NTDs prevalent in the country. We're talking about lymphatic filariasis, trachoma, Gisto, and STH. These are the 4 NTD that were captured, and the data from these NTDs came from the Federal Ministry of Water Resources, while the wash indicators came from the Federal Ministry of Water Resources and Sanitation. The NTD wash combined indicator data elements were agreed upon, and is fed into the final dashboard on the WashAIMS platform. Now, NTD prevalence data was exported from the NTD snapshot, which is owned by the Federal Ministry of Water Resources. Now, usually this data is fed from the subnational level to the state, from the states to the national Federal Ministry of Health, who compile this into a snapshot data, and it's usually held in Excel sheets. For the wash data, this is found in the wash norm reports, the survey reports that the Federal Ministry of Water Resources conducts to ascertain the status of wash in the country. You'd see down here is a snapshot of what the dashboard looks like. If you go to the next slide, we just have a few comments on key learnings from the development of the NTD wash data merge. Interministerial engagements are very important to achieve integration. This is one very strong area that worked for us in achieving the data merge in Nigeria, especially having the buy-in of the Federal Ministry of Health and the support of the Federal Ministry of Water Resources, who agreed to have the NTD Wash dashboard hosted on the WashAIMS platform. And then cascading integration efforts to the subnational levels is also another way to ensure sustainability of the efforts and timely data collection. for updating the data on the dashboard. This is because most of all the data that you find are generated, from the intervention units, and having that data timely, uploaded to the national databases is also very, very important. And then following the launch of the data, we're beginning to see that joint program planning and implementation is relevant to ensure prioritization of endemic locations towards achieving the ideal situation for high wash coverage and low NTD endemicity. This is because most of the states and relevant ministries are able to relate with the dashboard because this data actually comes from them. And so the dashboard is readily accessible and relatable to the persons responsible for, making these planning decisions and others. And then also leveraging on existing structures and platforms for both NTD and WASH intervention areas ensures quick wins for that can be built upon. Following the launch of the dashboard, different actors in the NTD and WASH space are now able to, understand the existence of, available structures within their different locations or systems, and which they can, quickly engage with to strengthen collaboration efforts in their various programs. Okay, this is just a quick view of what the NTD WASH dashboard looks like. And you can see the link is there. It's live and accessible. Some of the features that you find on the dashboard is you see a map of the country showing all the intervention units, and then there's an information box, giving you a summary of the NTD indicator and the WASH indicator for a selected intervention unit or state. And then there's the box. There's a box that shows a key, like a key box that shows you the color coded, box that shows you what the situation is in a selected intervention unit. And of course, we know that the idea is to attain an ideal situation where we have low NTD endemicity and high WASH coverage. Okay, this is just a photo just showing how a cross-section of participants during one of the meetings at the subnational levels, accessing and using the NTD WASH dashboard during one of their planning meetings. Thank you very much.
Apparently, we've got a small technical issue on the virtual side. They can only see us, which is probably not as ideal as seeing the slides as well. So I think we're working on that. But while that is maybe being sorted, are there any comments, questions regarding where we've gotten to so far? So for either Naomi and the Ethiopia experience, or Okene and the Nigeria experience, and I think both of them have sort of underplayed what a big achievement getting this across the line was. In Nigeria, there was a lot of media coverage, which was really exciting to see. That like national headlines. You don't often get to see data in national headlines, so that was kind of cool. So I'll open up the floor, and I'm also kind of managing online. So if you want to help,
yeah, that's fine. If you can manage the online participation, and so we're going to have now just a few minutes for questions and clarifications. questions on the presentation that we've heard so far. And then we moved into a more kind of structured group discussions for the next 15 minutes. But maybe let's just pause here and 5 minutes if there's any questions or clarifications or to our speakers. Rachel.
Sure, thanks. I'm Rachel Belts from the Finance Institute, and I wanted to ask about the granularity of the data. I think it seemed like for most of the presentations, it was maybe at the district level, but I just wanted to hear a little bit more about that, if that was granular enough, if that, that was sufficient, or, if there were challenges, and also related to that, I think you mentioned that some of the data was modeled, and so, how much of that was actually available versus.
Yeah. So maybe I'll let Jody to comment on the model data and then perhaps
Sure.
or Naomi and.
Yeah, I mean, that's a really good question, and that's obviously, I think that's been the struggle is that, either you've got, point level data, so you've got, five, latrines in a village, or you've got a national level data. How do you kind of find the middle spot in those two things? And so part of that was this model data. So all of the data on the ESPN platform, the Country Health Information Platform. Also, I should mention on the ESPN platform, it's not just CHIP. You can also download just the raw data file, the raw Excel file. But again, large asterisk, that is that model data from 2017. Now, here we are at UNC. There could be an opportunity to remodel that data, so with more current data, but it's still model data. So and again, I think that but then in the case of Ethiopia and Nigeria, and I'll let Oteni kind of go a little bit more into detail of explicitly what the Nigerian WASH data is. That is much more real-time data, and they have a much more granular level. And so in kind of combining that was the best possible scenario is for neglected tropical diseases, because the lowest unit we have for NTDs is the district level. So making sure that was at least merged. And then I think, moving forward, certainly as we get closer to NTD elimination, sub-district level data will become even more important, right? Because you'll have hotspots and like what's going on in these 5 areas, right? So I think that's the next step. Yeah, and I don't know, Naomi or anyone, maybe Oteni, you could comment on the WASH data from Nigeria.
Oteni, can you hear us?
Okay, yes, I can. I didn't quite get Jody, but if I understand, the question is about the level of data collected. Is that correct?
Yeah, can you hear me better from back here? I think the question is, Oteni, at what level is the WASH data collected and how often, and what granularity do you have is that WASH data collected in Nigeria? And if I remember, it's almost everywhere, but not everywhere in Nigeria.
Okay, so for the level, the WASH data comes from the states, and within the states, the WASH data is collected at the local government areas. So I think that would be the intervention units, if you please. So the data for WASH comes from that level, and it's collected from that level. In terms of the regularity of the WASH data, most of the WASH interventions are actually continuous and ongoing. Although we know that there's a survey that is conducted, the WASH norm. The WASH norm is actually usually conducted every year or every 2 years. This, of course, according to the Federal Ministry of Water Resources, is subject to availability of funds for them to carry out a wider nationwide survey to look at all the indicators for WASH, especially in terms of access to sanitation facilities and, status of open defecation or status of the intervention unit. However, you have ongoing actions that happen every year. So the data is updated, as regularly as possible.
Thanks, Attorney.
Thanks, Attorney. Naomi, you wanted to add something to that?
Yeah, just, and from what I understand of how data is coming to Ethiopia for the DHS2 system, a lot of data actually comes from the health post level, which is very small, and a lot of it is aggregated to the village. So for example, open defecation rates are village level, whereas the endemicity is more district level, but there are certain things that are sub-district for sure.
Any other questions? So one at the back and then here. Yes.
So thank you very much for the opportunity.
So,
I just have a quick question for anybody who as we programs, particularly within the NT store elimination, the need for data is very, very high. And if I took LF as an example, even though mobility data does not indicate that LF transmission has been obtained, in certifying or indicating, validating whatever it is that LF has been eliminated, mobility data is very much required. Do we know of any other diseases that requires WASH data in order to indicate, certify that that particular disease has been eliminated? For which reason we can provide some more substance to the fact that this integration is very necessary. Because if we don't do that, some of these things, then working in silos, looking for your own success story will be the order of the case. That's the question. Thank you.
I can answer that. So just quickly, and then we move to the next questions. So the dossier for that countries have to fill for the validation of trachoma elimination, right? It doesn't actually, it requires information on WASH. So I guess it's not necessarily that, the validation is based on disease endemicity, but there's still a section on WASH that requires reaching out to the WASH sector, that requires a conversation. And I think the intent of that section on WASH in the dossier was exactly that, is to provide an incentives for the WASH sector to engage and also see, to what extent the efforts have to be reoriented or accelerated, or in order to further support and sustain the elimination efforts. There was one question from Nepal.
Yeah, so my question was more to Naomi. You mentioned, first of all, thank you for the presentation. It was very insightful, and we could draw something for some of the initiatives that we wanted to do in Nepal. I was just curious to know a little bit more about the user side. Like when you say you collect information from the village level, like who are those users? And also from the equipment and how does the data talk to each other? Like how does it flow from the village level up to district, subnational, whatever level it is? This is very important for us to know, because then we can also perhaps think about replicating some of the models that have been generated out there.
So not a data expert in Ethiopia, but from what I understand of how it works is that for DHS2, for the NTD data, they collect it from the health post. It's considered a one report system. So the information from the health post is then aggregated at the village level, and it's slowly sent up. So they have regular reporting periods. The trick is integrating in the WASH data, because that's not a part of the regular reporting that they work with. So they do have certain things from the health post, like how many treatments were given, like what conditions report, like a lot of also prenatal care indicators are on there. So that's more the health data.
Okay.
So the trick was the WASH indicators.
Yeah.
So for those, the way that the information was used is that these coordination platforms that are set up, they're set up on, there's a national team, regional, zonal, district, task force and technical working group. So the technical working group are the experts. So it's a WASH expert and NCD expert, not the heads of the office, but different people, and someone from education, the school improvement officer, for example. And they are kind of the ones who go to the field more, they get together and they share the data. And then there's also a task force, which are the heads of the office for these 6 or 7 sectors. And then they meet and they look at the recommendations from the technical group and they make use this in their planning and decision making. So the data is more than just what's in the database, it's also that human elements of bringing everyone together. Because I think a lot of the issues with having different data sources is trying to match it if you're not with other people to understand exactly what's relevant. So I think having these platforms also really strengthens the data and strengthens the coordination to know who you're working with. In general, like these platforms are supposed to meet, technical working groups are supposed to meet quarterly, and or they're supposed to meet monthly, and the task force is supposed to meet quarterly. And they also have quarterly supported supervision where they're supposed to go to the field and see it. But as I said before, the challenges of getting those WASH integrated indicators more into the regular reporting and monitoring. But at the district level, we've had a lot of success with, for example, on the school level, the cluster supervisors who visit different schools, we got them to add some WASH indicators when they're visiting the schools. So not just looking at the teaching and learning that's happening, but also looking, are there enough latrines? Are they clean? What's the water access? So getting them to add in as well. So we've definitely had success on certain levels, but also making sure it reaches the top. So
Thank you.
that answers the question.
Yes.
Hi, good morning. Thank you so much. I'm Asifa from Jackson University. These platforms, systems, they are great. I mean, a lot of efforts are made in the development of them. But unfortunately, accessibility has always been a question. I mean, these platforms are not made available for wider audience or users. The ownership remains with them. With the entity who's responsible, and then other entities, they are not able to access the databases or get information. So in terms of Ethiopia or Uganda, Nigeria, how are they available widely for everybody so that it can be used, or they're just with the local entity, 1 or 2 entity, and that's it?
I can answer for they're very different stories. In Nigeria, you can actually go to the WashM's NG, WashM's. The site is there, but you can go there and it's accessible to anyone. So you can go online and you can access the WashM's portal. You can access actually any of their portals. There's very few of the portals that only admin level has access to. So in the case of Nigeria, it's a success story in terms of you can get there. The conversation you're going to have around once you're there, I think is that's the part that we really want to bring communities together and have that conversation. Ethiopia, there's a lot more admin to go through.
Yeah, I love the accuracy. So funny story, I actually used to have access. I don't anymore, but yeah, I just do. So you have to they have certain people who automatically have access in the health sector. If you're not one of those people, you have to request access with a formal letter, and then you should get access. And I guess you have to renew it, and I didn't, so I lost access also. Though I'm sure if you have a good reason, they'll give you access, but like I said, it can be tricky if you want people from the raw sector to also consult this data. So that's why we have these platforms to try to get around the bureaucracy and meet in person. But I do like that. That's great in Nigeria that it's open for everyone. I think especially for donors who are interested too. It would be such a great advocacy.
These databases, they are available, but donors and other people, they invest again thousands and thousands to build them, and then again not use it.
I think I see one more question, and then I think that's a very good segue into, a lot of effort is being put into bringing this data together, mapping, have really nice displays. well, with some varying quality, of course, like model, real data, different levels. But the question is like, is it actually being used by whom? And then, perhaps I'll ask you to ask your questions related to that.
So as the discussion is going to. So what another question is, how does this system that is set up interact with the district level information system? You don't want to, again, create the so we have certain things happen. So how do we basically work together on
I can answer on behalf of the Aspen portal, right? So the Aspen portal, that at least the NTD data that flows up through there, that all has been aggregated and agreed on. So it's the national program that's sending in their annual data to the WHO. Now, that said, oftentimes districts are like, well, wait, that's not true. But so there's lots of timing on the data. So, but at least for Aspen, it's as coordinated as sort of the current level of WHO data. Now, for the other databases in Nigeria, they take the Aspen snapshot, they take that data, or they take that level, and they integrate it into the WASH. So it's at the district level, if I'm correct, attending. But again, this is a big question, is making sure that we're not comparing apples to pears, or we're duplicating efforts. So
because you want to see that integration happen national level before it goes to the regional.
exactly.
Yeah, so maybe that's a nice segue into the kind of the next, we thought we would have a better discussions like structured a little bit along the lines that we started discussing just now. There's 3 questions, and some of them we just covered just now, but we thought maybe nice to break in a few groups and brainstorm a little bit and reflect on this information. Is it useful? Is it helpful at your level from the activities you engage with? I mean, which of the presented models or scenario would be especially useful for your work? How would you apply the data merge in your context? And are there any other data sources that could be considered to be used for improving equity and targeting? So perhaps we could just have maybe 3 groups, I propose, and we also have online participants, and we've set up a mural exercise by clicking on the link that you can see on these slides. I think that now all online participants are able to visualize the slides. So if you can just use the link, and I think it's been posted in the chat box as well, so you could directly access the mural. You have these questions, and you can use. You could log in. There's post-it notes, so you can join the board as guest. You don't necessarily have to log in with your details, and you just use the scroll on the mouse to zoom in and out, and either use the existing post-it notes by clicking once on them, or you can add new ones by double clicking. And our colleague Yael Velman will be on hand to keep things organized a little bit. And so these are the instructions for the online participants. But maybe in the room we just have 15 minutes. Just keep it quite short, but maybe organizing 3 different groups to kind of reflect on this. So just to keep it fairly straightforward, we do 1 group here, maybe just around here. So maybe we can group a little bit. 1 group here, and then 1 more group at the back. Is that okay?
Should be deploying one different groups.
Each of us. That's why I did 3.
So from the presentation for stock. Vehicles not relevant here. I have very curious actually here.
Yeah, maybe it's something. If any of this useful.
An example, of it, so that emerged before or something more than that. The third one was the Excel tool. You know,
We had one in us. That's from the ministry.
so there's three different sectors.
And.
I couldn't find.
So I think the consultative process is a really big part of it, so it was months in Ethiopia, maybe even a year. Different sectors of the government, they talk about it, advocacy, they brought together. It's a very strong consultative process, and also a year. So that's a big part of it, so opening that to see the conversation, see what to include, how to include it, and how to make sure it's updated. So that's the other problem is, I think even Ethiopia, I don't know if it's being updated as much as it should, so. Part of the. Right, versus there are some systems, some database that tracks the health data or the. Or is it that we just know and have to go through the. I'm looking at some of the situation and I'm saying, like health monitoring database or.
There's the hiding level.
I should say that, so,
What is the
particularly for ways, if we're going to have something like this, I don't know, but remember how we were.
But I think in terms of one of the most things we need to
programming.
That's right. And the consultative process at the beginning, I started, and then they continued after the semester, there's a lot of,
And
in-person.
where it comes from, it also in a teaching. The question around. How this data.
Did you, how would you apply? Community working with.
apart from the Ministry of Work and so we have to more do that. We don't have it all.
Yeah, so that
It's
would-
like difficult to manage the data of other ministries, internal data. So our views are. Get a part of the from the supervisor, staff nurse,
And then we've got all kinds of issues.
Yeah.
But private sector for me, ensure that it needs to be covered.
slightly
in order
like vast data.
And then we've got NDA.
That is the challenge. How we can
We've just
manage
done
the challenge.
quite an intensive trial.
Because we're
And now
vast
it's
data.
quite severe
I think.
payment because we were interested in
So there is no any exact model we can apply.
7% of those with the.
Yeah,
So it's like you should be able to start, I think the watch time too, that you know, that's so prioritizing. Like I said, making sure it's
And you're looking at regular wash indicators as well. And things like that.
properly
So now we're beginning to see particularly things like the phone and you need to go in some of these type of areas.
That's the good one. You don't have to
We've got
go
high
to
pressure,
geos,
but actually not a lot of them that
they never.
And then I guess I'm interested more in thinking how we.
So what else?
look at it,
Are there other
make sure we're actually working.
support?
Where we actually have the best.
Making sure that these projects,
Run of the work,
you know, help with disease elimination and cost of
Other.
fighting other deaths are considering that emergency.
Really, really granular data.
My perspective is probably small.
What do you mean? Air to that. Search around the planet, like, please.
And Sharon, anybody else see how much to read to wash data and large agencies? Yeah, then it would be interesting. I'm interested now to look and see whether there are areas that are, say, no wash coverage, whether that matches with what we have.
Where's the space to include the language that was not really curious about the usual flexible. So I had to like. To make sure that it's like. Like literally saying that's taking, you know, like on like. That would be really interesting to understand like that encouraged. Like how do they necessarily what changes that are selected really might, but like is there because is it actually being used to, you know, even though it's great, it's great, I'm not sure what is tracking, but what else happens.
So in Ethiopia, we do on the technical work here. Projects for areas. They're starting with this smaller one.
Whether the data on how real the image is. I think the idea. That's the not bringing those together.
And then things like geos that they're, these are the different for their donors and for their. So there's a break, but we do have these work vision. This is really go and collect data together. And then you have this discussion, I think that's one of the biggest discussions. What are they looking for? So create these right checklists. The hidden geos are part of it, not the discussion there. And it's shared with everyone. It's just really important. It's not always integrated.
So when you're gonna have like it's data, but it doesn't. Any others? I didn't walk okay, you understand? So the useful advice you work in.
I think. In terms of the I'm done from the University of Alabama, and then like assessment.
The one that. If they know, it goes there. They kind of. And there's also been a urban area about. So it depends on how it's set up. I mean, I know that you do so much work. So I'm all of definitely advantage of you being. Included in a lot of the district level, even the show once you include the version.
But about working every day, having it all that.
And we don't want to be doing the same work.
Dealing with just a number
So that's what we're trying to do by making a platform that everyone comes together. Even if the system is still catching up. To making sure everything's monitored the same way. At least it brings everyone together. There's a training for everyone to have some training, online training. And it's the level of involvement is goes on. We do encourage. So not sure how to keep it.
Yeah.
What they're doing.
Level of admin.
We do, we have.
Share data.
We want all that.
But again,
Like,
again, it
government
could be something
businesses,
common.
sometimes also private companies are, so there's
Example, in Ethiopia is
whoever is involved. in the
outside of NTD.
On the national level, it's got lower governments, but on the district.
Went on just to that access to the database, and they actually.
They want us to think about how to,
In new.
you know, like how do you think you can
I-
improve
Back
the.
to your end,
the
how we get
tax
endemic
share,
targets,
every
but
year.
they did really
Like,
like for
Russ,
us
I'm
funding.
looking for ideas too.
Operators. So-
If you have ideas about what you think would strengthen this, type of.
So one is for building information management system, that is as a master. Every data is for this as and yes, why it's numerically and everything is very clear. Watch them.
So that the owner of community.
Yeah, overseeing.
And then for.
To go beyond the.
Call
I see.
So that's.
Accessibility and.
They were not like.
In the back, I yeah.
All of it's also.
Equalize pay much before. And you can share those questions.
Are there other data sources, other places we should be?
Very helpful. Happy compliant to understanding.
It's a very organic tool. Get better at it. So. You're more than happy to here.
Like, what did I do? What did I do? Like with the US systems.
Does it like.
When you ask the topic, negative topic will be like the data store and I answers for the data. So there are 3 data systems.
Are there other diseases?
In last, what
Can anyone access
So
them or there's?
so we have to access all the data in one.
Yeah.
Yes, otherwise we have a lot of data and. Aggregated data. When was, I think, percentage is quite a few. Different indicators would be. How do we incorporate all these data into.
So I was saying about making the data useful. So you have all this data and it's great to have so much data. How do you? So make it like.
Right now, I think why is saying it was through watching. Yeah, may be available for one time, I guess. But, we're also planning on looking at like no longer integrating data from all kinds of different sources and have it back into out, but not to front end.
So I'll check. Yeah, Ethiopia, yeah, I'll check with the facility level, the school. Yeah.
It feels like we were and it's. Like.
And that's like you said about like the completeness of the data.
Eventually.
Like, even though it says that their latrines are still using them or clean, if it says that there's a water. There's still.
Even just like the, you know, the.
Trying to know like.
The way it looks. The
The
giant, the Nigerian. Really.
Yeah, I know for all the kids, I know. like,
That's
our
what-
kids,
The ministry came up with.
Like I didn't see it on any.
Okay, great.
Like,
Yeah, I think that's what I know.
Anyone else?
Just like that should be really front and center. Like.
I don't know, I think there's supposed to be age and like school age. Secondary. Don't be like, I'm like, with all the board, but. You know, there are some. And I get. Read that back.
The Japanese population has, and all these, organizations, they have their own, the problem is how to bring all this together and make them how to more. So we have an island there, an island there, but bringing all together.
I didn't. So they are big, or they were. Notice for being a wash.
They didn't come back.
Starting with that, I also.
So they have their own, always coming back. They don't want to come together.
It is a study there, Washington, and just adding 6% extra budget to some of their projects and focusing on the health. For the health sector, it's a lot more expensive than stuff. For the Washington, there, so it's a very minimal to include the health. So they were a big advocate, so they were, they were driving for us, like, I guess, trying to get.
The Nigerian platform. The estimate.
Correct.
Ethiopian one.
Very
If
different.
you can get as far as.
Although
Homepage.
it's stronger argument for donors, so, you know,
But-
you're helping to eliminate the need.
Contact us.
You know, and being like, so good on school now. So if you can argue these, right, you know, it's been touched on for me. And also it shows that the government is being more effective.
For me, really,
Yeah.
the estimate. If nothing else, we're running. But anyway, thank you for coming. Quickly, at least, and find any of us. So for those of you online, you can still hear. People are still talking. Thank you very much for joining online. So you can see here in the room, I don't know if you still see we're still convening, but thank you very much. Please contact myself, so you know, me, Yale. Any questions? Thanks for joining this session, wherever you are.